This is the hemodynamic graph, which is available in Nihongo monitors. So idea is this one. So before conventionally, we have many hemodynamic parameters especially in ICU or sick patient in OR, right? Then we can see it on the table like this. Okay, so there is a heart rate, cardiac output, cardiac index in the graph. Okay, there is good information already. But of course, there's a range. For example, the doctor is thinking like, okay, now patient CBP is 3 millimeter Hg, cardiac index is 1.7 liter per minute. How much fluid volume? So okay, so doctor is using this information, and then they decide what is a good treatment for the customers. Patients. Okay. For example, there's a target like a CBP normal values or 3 to 8, CO normal values, CI normal values, PCWP. So all parameters has values, and it depends on the sickness and depends on doctors, depends on patient condition, right? But so our idea is to visualize this information for doctor to make it more intuitive and more understandable. This is just an example. So our hemodynamic graph can make this XY graph. Okay, this is a combination of two parameters. For example, this one. So the horizontal one, this is a CVP. Okay, and vertical one, it's CI. Okay, cardiac index, and also there is a target. So in this case, CI should be more than 2.2, and CVP should be between 8 to 12. Okay, this is a target, and we can change it. Okay, it's a flexible. Idea is, so when we get the patient vital sign, I'm not sure if you can see here, so patient condition is here, okay, which means very low cardiac output and a very low CVPs, which means fluid is very less and the blood flow is very less. So doctor can decide, okay, this patient needs fluid, so we can start fluid challenge here. So after giving the fluid to the patient condition is moving like this, right? So we can say, so this patient condition is going well, right? But in this time, patient still has low cardiac index and low CVP. So doctor can decide to keep it, okay? Still, doctor can keep it, and then, so when patient condition is coming into target zone, so this is time to stop the fluid. Because if they keep the fluid challenge to the patient, so patient has like a modern like too much fluid inside, too much blood inside, so which cause like the lung troubles or heart troubles. So cardiac index will go down. So this is important to know when we have to stop this fluid. So this target zone really helps this decision. So we can know what to do and we can know when to stop these things. And also this is another example. We can have the cardiac index here and also CVP here. So in this case, patient is the right upper corner. So here, which means patient has too much fluid. Okay, so which means we have to reduce this fluid from the patient. Otherwise, heart have to work very more and the lung has some problems. So in this case, this medication can be decided by doctor. And after that, if patient condition is going down to the right down corners, which means the heart is not working and fluid is too much. So in this case, we have to think about this vasoactive agent, like which is different medication. Even the patient condition is very bad, so we can think about this assisted circulation. This is the idea of this graph. Okay, so each position has meaning and the hint for the decision for doctors. And also maybe this PPV is kind of very well used in the hospital compared to CVP in nowadays. So this is also right. So if patient condition is good, so condition is going like this, as you can see on the yellow, the dots. But if patient heart is not good, patient, this dot can go like this. Okay, as you can see on this orange, the arrow. So in this case, fluid is enough, but heart is not working. So we have to assist the heart. Then doctor can decide this vasoactive agent or assisted circulation, like PCPS. So this is very nice tool for doctors to visualize it and the combination of the parameters. And we can have.
Okay, so according to this hemodynamic graph, so we can see on the monitor, we can go to menu, and there's hemograph. Okay, we can touch here, and we can see these three graphs. Okay, so if we go to here, so the setting is pico and ppb. Okay, and we can change these parameters to go to setting here. So x-axis we can choose from there, ppb, spb, svb. Of course, this parameter depends on the doctors, but the ppb and svb is, let's say, the common parameters on this, the x-axis, to see fluid responsiveness. Okay, and for y-axis we can have like these parameters. Okay, so if patient has a pico or Edwards, the flow track, the parameters, we can choose these ones, pico or even the CCO. So it depends on the patient, but it's anyway available here. And even we can choose this one, the arterial pressure for this trend. Okay, but maybe for sick patient, they have pico or the Edwards devices, so maybe we can recommend this ppb and pico or the cardiac index. Okay, so as I mentioned, we can have up to 3 graphs. So one is this one, and second one is this is also flexible, like this. Okay, and this is just an example. Sometimes doctor want to use this one, the atrial pressure mean, and also the CVP means. It's kind of old style, but still some doctor want to use it for septic patient. For graph 3, this is the fix for Forrester classification. Okay, so this is actually well known in between these intensivist or cardiologists. So you can say Forrester classification to the doctors and all of them knows. So Forrester, so there is a cardiac output and the PCWP. Okay, so that's the basic idea about the patient have to be here. This is a normal condition, and also this is the hypovolemic. Okay, and this is like a shock. Okay, this is too much fluid inside. So this is the common understanding. And if patient condition is very right, if patient condition is here after fluid, patient condition is like going like this. Okay, but patient heart is like not good, like heart failure. Patient condition is like going like this. So to see this curve, doctor can understand the heart condition of the patient.
Older is darker. Yes, something.
The newer is
light.
more lighter. Yes.
Yes. So something in that. So in that pattern, you will understand that which direction it's
Exactly.
going.
So the treating doctor, intensivist, is just coming to the monitor, clicking on play, and he's seeing the last 30 minutes, as I understand, right?
Yeah, or just more long term.
Or long term. Okay, so it can be changed.